The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening, everyone, and welcome to a festive edition of Question Lab. We're bringing a holiday twist to our exploration of microbiology and immunology tonight. So we are glad that you're here. I'm Jeff Downing, and I am going to be your guide as we navigate some challenging step one style questions areas. And again, we are thrilled to have Dr. Abraham Titus as our guest expert. So Abraham, would you like to introduce yourself to the crowd?
Sure. Thank you, Jeff. So my name is Abraham Titus. I'm a hematology oncology fellow currently at the University of South Alabama. Been a tutor with USMLE-Rx for quite a few years. Introduce yourself through step one, step two, and even step three. And I'm excited to be here and go through some high yield micro and immunology topics.
Yes, and Abraham has picked out some good questions for you. So we're lucky to have him, and we're happy to help everyone here understand some of these topics a little bit better. We also have Kate with us, and Kate is going to be answering questions that come in through the question box. I see one of those questions is already thinking that we were going to be tackling respiratory. So apologies if that was a miscut tonight. We are going to be tackling micro and immunology. So stick around. There's still a lot to learn and a lot to gain here. Again, as we go through our questions, along with building, QMax and building the nearly 5,000 questions that we have here in QMax, as well as all the other tools, we really like to focus on helping you understand how you get to the right answer, right? How you, are to slice and dice a question on exam day. So we're going to be focusing on that. So we're going to, for us, we really want to think about the methodology. We want you to be able to develop or sharpen your methodology as you go through not only the questions tonight, but as you on your own. There is that point where, especially, for students that are going through, first year, second year, so much knowledge that you're trying to absorb, so many facts you're trying to remember, and, lots of different ways in which, you can try to storehouse some of that knowledge. But when it comes to, the highest yield activity that you can do, it is answering questions. And because on test day, and this could be, for a self-assessment exam or CBSEs or even step one, there's a lot of factors that kind of converge here. And so as we go through our questions tonight, we're going to kind of walk you through our methods. Okay. So dive in. Our goal is to help you feel more comfortable and confident technology and immunology concepts. Similar questions, on your exam. So again, definitely to the question box. If you've got questions, let's kick this off. So the first thing that you're going to see when you look at our questions here in Question Lab is that there's something missing, and that something is the answer choices. So that is our step one. We want you to cover up those answer choices. You need to be focused as you go through these questions. So if this is your first time going through a Question Lab, we'll take these steps one at a time. So we cover up the answer choices just in case. I mean, there may be an answer choice that you're unfamiliar with or that has tripped you up in the past, and those little things can distract you, right? Or they can lead you down a bad road. So we say first, cover up those answer choices, and then second, read the lead in. Okay, students that start by reading the vignette, which is the scenario. Some of these vignettes. This vignette, for instance. There's a lot here. By reading the lead in first, you're able to anchor yourself, right? You're able to kind of frame the way that you're going to approach all of the dating. Okay. So again, first up, you cover up the answer choices. Second, we read the lead in. which of the following is the most likely causative organism for this patient's condition? Okay, so I come in here, now I know what I'm aiming for, right? I know what the objective is, and obviously I've got an X-ray here as well. So now I'm ready to read the vignette. So let's do that now. A 68-year-old man is admitted to the hospital after an insidious onset of fever, shakes, a severe headache, watery diarrhea, abdominal pain and muscle pain, weakness, and cramps. His symptoms started approximately 1 week ago while he was at home and progressively worsened. He has not been hospitalized or visited any healthcare facility in the past several months. On admission, he is examined for shortness of breath requiring assisted ventilation. He initially had a dry cough, but has become more persistent and productive. X-ray of the chest is shown. Microscopic analysis of the culture of bronchoalveolar lavage fluid shows an aerobic bacillary pathogen. So again, the question, which of the following is the most likely causative organism for this patient's condition? Go ahead, head down to the question box. Let us know how many steps you think it's going to take to solve this one as I turn it over to Abraham.
So this is a pretty high yield question. You want to be thinking about what's happening in the situation. Just like Jeff mentioned, the most important thing is to look at the lead-in before assessing the vignette. So let's go through, let's highlight some keywords, and let's talk about what's going on here. So again, with the lead-in, most likely causative organism is what we're looking for. So we got to think about, okay, what organism? It's not asking you, what the treatment is. It's not asking you what's happened diagnosis. It's asking you causative organism. Okay, so very classic step 1 style question. You see an X-ray aware of as well, and there's, obviously a clear consolidation there. But let's read through the question and try to figure out what's going on here. So again, a 68-year-old man, always think about who you're dealing with, right? It's not elderly, not very elderly, but also not a young man. So 68-year-old man. Insidious onset of fever, shakes, headaches, watery diarrhea, abdominal pain, muscle pain, weakness, and cramps. So a lot of symptoms for just someone who possibly may just have something respiratory going on, right? So there's something respiratory, there's something GI related, there's some muscle issues going on, and the fever is insidious. So that also kind of give you some clues of what you should be thinking. Am I thinking of something bacterial, viral, fungal, or something else? About a week ago, it started at home. That's important, right? So it's not hospital acquired. It's from home, the community he got this. So that also helps differentiate some differentials that should be in your mind. Again, he's requiring assisted ventilation. So whatever is causing his respiratory problems is getting so bad he's requiring assisted ventilation. And then they show the X-ray, and they do this culture where they kind of give you a big clue here. BAL, bronchoalveolar lavage, and it shows aerobic bacillary pathogen. So this draws right back into your microbiology knowledge and kind of thinks about, okay, what are my bacillary pathogens that can affect my lungs, and which ones can be seen in the community as opposed to the hospital. So you got to start thinking like that. Like those are the big clues that are giving you, and start going through your differentials in your mind. All right, so let's then think of an answer. What could this be? And then let's look at the options. All right, so classic 5 options here. I always like to start with E and make my way up to make sure I ensure I read all the options and don't just anchor on my first one I see. So option E, Pseudomonas aeruginosa. Option D, Mycobacterium tuberculosis. Option C, Legionella pneumophila. Option B, Klebsiella pneumonia. Option A, E. coli or Escherichia coli. Now, what am I thinking about here? Which of these would fit this bacillary aerobic pathogen causing pneumonia, causing GI symptoms, causing muscle issues in a community setting, and would present with an X-ray like this? So that's how you should be kind of thinking about it. They're giving you big clues that are kind of guiding you to get to the answer. This should be relatively straightforward, but if you don't know right away, I still want you to try to make a guess. Right? This classic microbiology style question, and I want you to kind of take your time and make a choice. And we'll discuss why things are right and why things are wrong after you decide that.
Okay, fantastic. So the poll has been launched. Go ahead and let us know which of these options is the most likely causative organism for this 68-year-old man. We always like to remind you that you're not going to be penalized for incorrect options, but you're certainly not going to get a chance if you leave a question unanswered on test day. So make sure you answer all of them. And we want you to answer all of them on question lab night. So far, we've got almost, I guess, are doing a pretty good job here tonight. Almost 75% of you voted. So go ahead if you haven't, and let us know. Okay, I'm going to go ahead and close the poll. And let's share the results. So almost half of you went with answer choice C, Legionella pneumophila. There was a tight battle for second place between B and A, and some of you went with answer choices E and D. So again, pretty strong consensus here behind C. So it's going to hide the results and reveal the answer. The answer is indeed answer choice C, Legionella pneumophila. So great job. Good way to start off the night. This one right, that's okay. Abraham is here to lead the way. So Abraham, walk us through this one.
All right. Well, great job, guys, getting this one correct. Even if you did not, don't worry about it. This is a learning opportunity. And, take this as, okay, this is something that I didn't know and something that I want to get right on test day. So make sure you pay attention for this. Okay, so what's going on here, right? So Legionella, we know, is classically an aerobic coccobacillus that is seen that can cause pneumonia, which is what's causing in this patient. If I look at the chest x-ray, I see this consolidation on the patient's right lower lobe that's presenting like a pneumonia. In addition to the pneumonia, what else does Legionella do, right? We get something called Legionnaires disease, which is a combination with the pneumonia, the diarrhea, and muscle aches, which can happen due to something called rhabdomyolysis. And if they gave you electrolytes, one of the key electrolytes you want to look for is sodium. Legionella can cause hyponatremia with associated rhabdomyolysis and diarrhea. Those are the key words you want to think about when you think of Legionella. Legionella is passed through like air droplets, and sometimes people say, hey, they were staying in a hotel and everybody in the hotel was sick because the ACs had Legionnaires inside them. That's the kind of general way that they'll describe it. And there's certain keywords that they'll use to describe how they visualize the pathogen. But in this situation, aerobic bacillary, should kind of think about the differentials. When I look at aerobic bacillary pathogens, my differentials, think Legionella, Pseudomonas, and Klebsiella. They are things to think about as well, right? But Klebsiella is not as anaerobic, and it's hospitalized acquired. Pseudomonas, same idea. You would not see Pseudomonas pneumonia in somebody who doesn't have cystic fibrosis, who doesn't have any kind of risk factors in a hospital environment and just walking in with a Pseudomonas pneumonia. E. coli, what does E. coli most commonly cause? Well, E. coli we want to think about. It's pretty unusual for causing pneumonia. Thinking more GI stuff, so the diarrhea would be explained by that, and most commonly UTIs, number one cause for UTI, and it's an anaerobic bacillus. Whereas strep pneumo, yes, that's a really good thought, but that's not in the situation as well. And we have TB here. Again, TB, not a great option in this situation because this is not tuberculosis, right? So this does not fit the picture of tuberculosis where you have the GON complexes or anything along those lines that would kind of point towards. And this person is not coming from a third world country, hasn't traveled anywhere, and has not been exposed to anybody with TB. So in this situation, the big clues are the diarrhea, abdominal pain, muscle aches, with the history of this consolidated infiltrate on the X-ray, and the fact they're saying the BAL shows aerobic bacillary pathogen. A little bit of memorization involved here because this is microbiology, but if you can kind of have a structured approach to answering these questions, you kind of memorize a much less than you actually kind of have to, right? So you just need to know the key important factors about each of these pathogens so you guide your way to get to the correct answer. So good job, guys. Definitely a great one to start the day off today.
Okay, yes, nice work, everyone. We're well on our way So let's head into question number 2. Again, we're going to have we have 4 questions during Question Lab, and we will have a raffle at the end of tonight's session where one lucky winner will get a subscription to USMLE-Rx with the RX 360 Plus package. So you hang around if you can win. So let's go ahead, and once again, we have covered up the answer choices for question 2, and you can see we've got a histopathologic image in front of us. So let's start by reading the lead-in. Which of the following is the most likely diagnosis? This may be the most commonly used on step 1. It's very traditional. Let's go ahead, knowing that we are going to be trying to make a diagnosis here. Let's keep that in mind as we read the vignette. A 36-year-old man comes to the clinic because of a 2-week history of coughing up green sputum, fever, headaches, and general malaise. He works as a poultry farmer in southwestern Ohio. X-ray of the chest demonstrates a 1 centimeter calcified, well-circumscribed lesion on the upper lung lobe and hilar lymphadenopathy. A histopathologic image of the lesion is shown. So once again, which of the following is the most likely diagnosis? I'm going to pass it over to Abraham to take it from here.
All right, thank you, Jeff. So this one's a little bit different question, right? You don't get an X-ray, you're getting kind of a microscopic picture of something that's going on. See this little glob-looking thing with a bunch of dots around it. We're going to delve into that and kind of go into what this is really showing us. But more important, right? Whenever we talk about pictures and X-rays and images, you want to use that in addition to our vignette. We don't want to solely rely on it, and we also don't want to completely ignore it. I saw a question about that. It was saying, how important was the X-ray in the last question? Well, X-ray is just showing us that it's a pneumonia, and then the rest of the question is what made me really think Legionella. It shows that's a lobar pneumonia, so my differentials start coming down. But in this situation, you need to look at the vignette, build the idea in your mind, and then look at this image. All right, so let's highlight some keywords in this question, and let's figure out what's going on. Again, just like Jeff said, most likely diagnosis. That's very important. So you want to just know, okay, I'm just trying to figure out what's going on in this guy. I don't care about, what the treatment is or anything like that. All right, 36-year-old man, a young male, 2-week history of coughing up green sputum, fever, headaches, and malaise. Okay, so cough, the respiratory stuff going on, some fever, poultry farmer in southwestern Ohio. So there's a reason why they put random little vignettes or little nuggets of information in the question. There's a reason for that. So you don't want to just ignore something like that. So there's a poultry farmer in southwestern Ohio. This is testing your geography understanding of the US, especially if you're an IMG. It's sometimes difficult to visualize where that is, but they want you to have a good understanding of regionality and where certain bugs come from. And the chest X-ray showed 1 centimeter calcified, well-circumscribed lesion in the upper lobe with hilar lymphadenopathy. Okay, so I'm giving you some clues there. So it's not just pneumonia like the last one, but you have a 1 centimeter lesion in the upper lobe. So it's almost like a lung nodule almost, but associated with lymphadenopathy. He's a poultry farmer and he's coughing up this stuff. And when they look at the histopathology based on his sputum results, we see this. So what's going on? Let's look at some options here and let's try to figure out what the answer could be. All right, so we have option E, paracoccidiomycosis. Option D, histoplasmosis. Option C, cryptococcus. Option B, coccidioidomycosis. And option A, blastomycosis. So you see a lot of these are very similar sounding and they can be tricky, but you need to know what's unique about each one of them and how they differentiate from each other, because whenever you get these kind of questions, these are the options you're always going to get put together. They want you to differentiate between these differentials all the time because they can have similar presentations and there's some regionality differences between them. And as well, the smear is also giving you a big clue into getting the right answer. So take a moment, figure out what's going on, and I want you guys to think of an answer what this could be.
Okay, everybody. go ahead and give it a rip. Let us know what you think is the most likely diagnosis. Giving you a few of the more challenging conditions to try to pronounce, much less spell. Overall, you guys are doing a nice job in answering pretty quickly here. Already 3/4 of you have cast your vote, so let's go ahead and get ready to close the poll. And we'll share the results. Okay, so once again, we've got pretty strong consensus here surrounding histoplasmosis. Second place, kind of a two-way race between blastomycosis and coccidioidomycosis. Okay, well, very interesting. So let's go ahead and hide the results, and we will reveal the answer. And the answer is indeed answer choice D, histoplasmosis. So well done, everybody. You guys are doing a nice job with these, with X-rays and with labs, all this stuff. You're doing well. If you didn't get it right, though, that's okay. We're going to walk you through it. So Abraham, take it away.
All right, so great job, guys. Again, this is one of those classic histoplasmosis questions. Definitely going to see something like this, if not on one of your steps, definitely on one of those practice exams for sure. So it's very important that you know how you differentiate your histo versus crypto versus coccidio versus blasto. All these guys, they kind of love to throw them all together and expect you to kind of know what the buzz things are and what the keywords are that are kind of pointing you towards one or the other. Okay, so let's break this down. So what are some big things for me here? So definitely 2-week history. So it's like a subacute, slow presentation of this respiratory thing. Whereas it's not like a couple days or it's not even a week where you're thinking more viral or bacterial. This is much more slow and insidious in nature. 2 weeks of just kind of this nagging cough and respiratory thing as well. So that kind of more indicates maybe this is something fungal going on, right? Something a little slower, something yeast-like. And what their key huge thing here is that he's a poultry farmer in southwestern Ohio. So histoplasmosis, if you guys remember from medical school, they will always say, oh, cave splunking and bat droppings. Well, that's true, but more commonly in the US, the most common cause of histoplasmosis is actually chicken droppings. So poultry farmers and people that work around chickens, and if they have chickens in their farms, that's going to be the ones that cause histoplasmosis. Histoplasmosis can affect the lungs, and it's from contaminated soil, bat, or bird droppings. Those then cause lung little coin lesions. That's what they're kind of explaining here. There's 1 centimeter calcified lesion in the upper lobe, and associated lymphadenopathy. Now, what's a smear trying to give me here? Well, the smear shows a macrophage with a bunch of these like yeast-like cells within it, right? So those little small ones are the yeast cells, and then the big one is the macrophage. So the kind of what they're trying to show is that, okay, you have 1 macrophage and a bunch of yeast cells within it. And, even if you don't get the picture right away, the very clear story of insidious pneumonia or insidious respiratory symptoms with this lesion in the lung that's 1 centimeter circumscribed coin lesion is what to go for. What about the other options? Okay, well, when I think of respiratory situations where something similar can be presented, well, the other option would be blastomycosis. Blastomycosis, they have something called broad-based budding. That's the buzzword that they'll use when they want you to kind of think about that when talk about histology. And when they give you smear, they're going to make the blastomycosis the same size of an RBC. So they want you to kind of think, okay, blastomycosis, broad-based, BBB. And they're the similar size to RBCs. They're also found generally in the same region as histo. So it's like the Central America, Mid-Atlantic, your kind of Ohio, Mississippi River Valley, that kind of area where it's like the Central America. That's where it's very common and prominent. Whereas if I'm going the other side, if I go coccidioidomycosis, you're thinking more like desert valley, right? So thinking like California, Nevada, that side of things, so more West Coast. And that's where we see a lot of these type of mycosis infections. And that can also present very similarly in terms of respiratory issues. And what that's going to be, they're also going to give you kind of a similar picture, but it's going to be smaller. Now, Cryptococcus. Cryptococcus is a whole different story. Cryptococcus, you're thinking about a heavily encapsulated yeast, where you kind of give you that classic picture in India ink. If you've seen it once, you won't really forget it. It's that classic, dark background with a pale center, where you have a thick capsule. And whenever I think capsule, anything that's capsulated can cause meningitis. So Cryptococcus can cause pneumonia and meningitis in immunocompromised patients. And this paracoccidiomycosis is very unlikely to be tested on that. This, you want in the Caribbean side. So think coccidiomycosis in the California region, and then paracoccidio is on the opposite side in the Caribbean kind of captain's wheel appearance. I haven't seen too many paracoccidiomycosis questions, but they love histoplasmosis, they love crypto, they love coccidio, and they love blasto. So you want to know A to D very, very well, and just be aware option E exists and kind of general region where they test about it. But good job, guys. Definitely lots of questions coming from this kind of style of question. So make sure you understand the regionality of fungal infections.
Okay, great info, the kind of high yield nuggets that you need to store away. So time for us to take a quick stretch break. So before we unwrap the next question, talk about a resource that can make your USMLE prep as seamless as a cup of holiday cheer, and that's USMLE. Whether you're just starting out or you're in the final stretch of your prep, USMLE-Rx is the ideal study gift for yourself. All the tools you need in one place to make your study journey smooth and productive. So within our RX 360 Plus package, which has the our entire integrated study includes RX bricks. We've got now I think over 900 of the foundational learning modules that explain the complex and key topics in a simple and digestible format. We've got over 1,300 express videos with these concise, well explained that help you again retain and synthesize the key information. QMax, our question bank has nearly 5,000 questions for step 1 and step 2, and we also have 2 self-assessment exams for step 1. So great way to kind of benchmark when you're getting into your step prep. And then of course we've got flash facts, and that's over 1,000 flashcards, all tied to the high yield concepts and high yield topics within our system. Skills are designed to work together so you can move effortlessly from learning to practice and from practice to mastery. So whether you're cozying up with your favorite beverage or powering through question sessions, we've got you covered. You got tens of thousands of students who've trusted USMLE-Rx to prepare for their board exams, and we're ready to help. So, okay, with that, let's go ahead and head to question number 3. So now we're in the home stretch. We're in the second half. Sometimes the level of difficulty increases a bit, but you guys have done a nice job tonight. And either way, again, even if you haven't gotten the questions right, main thing for us is that you're picking up on some of the things, and you're picking up on why this information is important, how it relates, as well as how this kind of content is going to be coming at you on exam day. So with that, we've got a question with some lab results. We have another image for you. So what we're going to do is cover it up, and we're going to read that lead in. And the lead in is, which of the following is most directly responsible for this patient's current presentation? Okay. So the nice thing here is, by reading that lead in, now you're not having to think about one thing or try to focus on too much. You're like, oh, okay, let me figure out what might be triggering this. So with that, let's go ahead and read the vignette. A 57-year-old Hispanic man presents to the office with a severe cutaneous rash over his back that has developed over several weeks and intractable watery diarrhea. 1 month earlier, he was diagnosed with adult T-cell leukemia and received a bone marrow transplant from an unrelated donor. He is taking an immunosuppressive regimen that includes cyclosporine, mycophenolate, and prednisone. The lab tests show, you can see what numbers for these, including creatinine, lactate dehydrogenase, alkaline phosphatase. So with that, again, we'll ask the question, which of the following is most directly responsible for this patient's current presentation? Another good thing for you to think about is, like, how many steps do you think it's going to take for you to arrive at the correct answer? So go down to the question box, let us know what you think that number is as I turn it over to Abraham.
All right, so this is a great question. This is, again, switching gears more of an immunotherapy or immunology, right? So we have a clinical situation here, and this is something that, I deal with all the time as a hematology oncology fellow with just my bone marrow transplant patients. And what am I going to do at this point? So let's kind of highlight some keywords here, and I want to, without giving too much away, maybe kind of help give some guidance on how to break down this question. Again, the lead-in is very important, right? Most directly responsible for the clinical presentation. So I want to think about, okay, the presentation, what am I seeing? I'm seeing some kind of rash going on this guy's back here, this little redness there. And let's read the question, right? So we got 57-year-old, okay, and has this cutaneous rash on the back, and that's been going on for several weeks. And diarrhea, okay, that's an interesting combo. We have a picture of a rash with diarrhea. This one connecting the two? Well, he's had T-cell leukemia and received a bone marrow transplant. Okay, so understanding what a bone marrow transplant entails and what are the complications of it are very important. Unrelated donor, okay, that's important as well. And he's on a bunch of medications, cyclosporin, mycophenolate, and prednisone. Those are my immunosuppressive medication. Why do we give immunosuppressive medication in bone marrow transplant? That's another thing you guys want to be aware of. And let's look at it, right? So ALT and AST are both elevated. ALT is 1,032 and AST is 829. So that's, shows something here. I mean, with the liver maybe going on, creatinine's okay. LDH is elevated, and alkaline phosphatase is also elevated. So what would kind of most directly be causing this? So first, this may be a multi-step question, and I think a lot of you guys have kind of also figure that out, right? It's not only just figuring out what's going on with this patient. Well, it's what's causing the underlying diagnosis. All right, so take your time, try to think about what's going on. And this may be one of those where, you have an idea, but you really need to look at the options to figure out exactly what's going on. So let's reveal the options here and let's try to understand what's happening. All right, so again, we'll start from the bottom and make our way up. Option D, recipient cytotoxic T cells. Option C, recipient antigen presenting cells presenting donor peptides. Option B, immunoglobulin and fibrinoid necrosis. Or option A, alloreactive donor T cells. Okay, so you're kind of some interesting words here, things that you may not be familiar with if you haven't kind of reviewed this part of immunology, but it is high yield and I want you to be aware of it because this is something, if you learn properly from step one, it will stick with you all the way throughout residency. So I want you to be aware of this, recognize what's going on, and be able to connect the dots. They want you to know the basic science understanding of what's happening. So when you get in the future, you don't get lost. So take your time, think about it. Which of the following is most directly responsible for the patient's presentation?
Okay, crowd. So we've put the answer choices up, and as I look at it, I see an answer choice that doesn't belong. I don't know what happened here with that. I would ignore answer choice C. Yeah, as Abraham noted earlier, most of the, your standard NBME USMLE question is going to have 5 answer choices, but occasionally you will few with just 4, and you'll see some that might have 6, 7, or 8. They've been known to mix it up. Okay, so let's see. Almost 60% of you have voted. And we've got an interesting split here. Luckily, nobody has voted for answer choice C, so good job. let's go ahead and I'm going to get ready to close the poll here. Give you just a few more seconds to cast your vote. Okay, so let us close the poll, and we're going to share the results. Okay, so this is really kind of a three-horse race, although alloreactive donor T cells kind of surged ahead here at the end. But almost a third of you went with answer choice D, the recipient antigen presenting cells presenting donor peptides, and a quarter of you went with recipient cytotoxic T cells. Okay, so with that, we're going to hide the results, and we are going to reveal the answer. And the answer to question 3 is answer choice A, alloreactive donor T cells. So done. If you got that right, nice work. If you didn't, there's a reason, right? And you know there are definitely things here that I need to kind of prompt you to go with D or E. So Abraham's going to break this one down and help you so that you get this right on test day. Abraham.
All right, so great job, guys. Again, this was a little bit tougher than your last two, so totally expected this to happen, but good job if you were able to get this right. And if not, don't worry about it. We're going to talk about it and figure out exactly what is going on. So in the question box, if you guys have a chance, can you tell me what the diagnosis is for this patient? So what is causing this patient's rash, diarrhea after this recent bone marrow transplant? So it's something that's very important to understand, and if you don't know it, that's totally fine. But this is a little bit higher level if you can be able to recognize something like this. Give it a couple more seconds. This is graft versus host disease, GVHD. So you may see that called GVHD and thrown around a bunch, but it's graft versus host disease. So what does graft versus host disease mean? Yeah, I see them all coming in now. Great job. So GVHD, if you break down the word, it's the word graft versus host. So what is the graft? The graft is the donor, right? It's the cells from the bone marrow you're getting from the person donating the bone marrow. And the host is the person getting the bone marrow. So what happens in a bone marrow transplant situation, especially in T-cell leukemia, where patient's bone marrow is essentially empty because they gave them a bunch of chemo and they're transplanting somebody else's bone marrow into yours. And why do we put these immunosuppressive medications? To prevent graft versus host disease. We are trying to prevent the donor's bone marrow from attacking the new host. So in order to prevent graft versus host disease, they gave a bunch of immunosuppressive medications. They got 3 different ones: cyclosporin, mycophenolate, prednisone. Pretty big guns here, but we need it. What happens is that when the patient donates their bone marrow, then their cells, lymphocytes, can start making a bunch of alloreactive T cells. The word alloreactive means that it's reacting to a different person, right? Autoreactive, it's reacting to itself. So it's a little bit complicated with the terminology here, but for step 1, they're not going to complicate you with auto and allo mainly. What they're going to focus on is that understanding that graft versus host disease is a type 4 hypersensitivity, which leads to a delayed response, which then where the grafted, so like the donated donors, T cells will grow and start attacking the host. So how does that explain the symptoms? Well, where is it going to attack the host? It's going to attack the host anywhere it chooses. It can attack the liver, it can attack the skin, it can attack the colon. So in this situation, the gut got attacked. That's what you have, the intractable watery diarrhea. The skin got attacked. That's causing the severe rash. The liver got attacked. That's what's causing the elevation in his ALT and AST. You can attack the joints and cause arthritis. You can't, there's no, this is for sure one or the other. You kind of want to see a classic picture of multiple organ systems being affected because you transplanted. Now, they are going to ask you sometimes, is this graft versus host disease or is it rejection? And that's a very classic immunotherapy question. The way I want you to think about rejection is, if it's rejection, that the host is going to destroy whatever the donor gave them. Graft versus host is the opposite, where the donor's cells that are in the host attacks the host. So these are some kind of key words you want to be familiar with and be able to kind of recognize what's going on here. So let's look at the other options, make sure that why those aren't correct. Again, option A, alloreactive donor T cells are what's triggering this graft versus host and driving this type 4 hypersensitivity reaction. Okay, all right. What about the other option D, recipient cytotoxic T cells? Well, if it's the recipient's cells that are attacking it, that should be a rejection, right? Not graft versus host. Graft versus host, the problem is the donor cells are attacking the host. So it's flipped. Option choice C, recipient antigen presenting cells presenting donor peptides. Well, this is seen more, again, it's a recipient problem. This is a chronic organ rejection problem. This is not graft versus host disease. And again, immunoglobulins and fibrinoid necrosis, that's the hyperacute rejection. So all of these are giving you types of rejections. The only one that is graft versus host is where the donor cells are attacking the host. A little bit complicated, but definitely a high yield topic to understand for step 1.
Okay, everybody. So nice work. Again, there's a lot going on in that question, and being able to kind of manage some of those different factors, variabilities, very important. So what we have now is our final question of the night, question number 4. Again, we're going to have a raffle here in a few minutes, where one lucky winner will get an RX 360 Plus subscription. You do have to be present in order to win. We also have a special promo going on. You can stick around for a promo. Nice discount for those that are looking. Okay, so let's go ahead and once again for our final question. This is a bit of, not every question lab has 4 questions with images, but when you're talking about microbio and immuno, you need to bring the visuals. So again, we've got the answer choices covered up. Let's take a look at the lead-in. And I will just say that this may be one of the longest lead-ins that I've seen within QMAX. So let's take a look at it. Which of the following organisms releases a toxin that acts by activating an intracellular signaling pathway similar to the one produced by the pathogen used in this attack? Okay, so to know what it is you're going to be looking for as you read the vignette here, it's pretty concise. So let's take a look. A 37-year-old firefighter is brought to the emergency department after responding to a suspected bioterrorism attack. Physical examination reveals skin sores on the face, neck, and arms. The patient says the sores are painless. An image of an ulcer is shown. So again, which of the following organisms releases a toxin that acts by activating an intracellular signaling pathway similar to the one produced by the pathogen used in this attack? If you can keep all of that in your head straight, I will pass it over to Abraham.
All right, great job making it to the last question of the night. Again, this one is definitely a tricky one. This is one that you do have to think about it a little bit, in the sense that it's not very straightforward, right? It's asking you, well, multi-step question, right? Let's look at some highlighted words here, and let's kind of break down what it's really asking us here. So, which of the organisms releases a toxin? Okay, so we're asking about an organism that's releasing a toxin, activating an intracellular signaling pathway similar to the one produced by this pathogen. So it's not asking about this pathogen, it's asking about, okay, this pathogen releases some type of intracellular signal pathway. What's another organism that also does that? So you have to kind of be very good at breaking down what the question is really asking, okay? And I see some answers in the options there where they're talking about, okay, this is what this is. Or you have to think about what toxin is being released by this bug, and think about what is a similar organism that does that. And it's a 37-year-old firefighter. Buzzword here are going to be a bioterrorism attack, and the skin sores, and that they're painless. And the image kind of gives you a classic looking black. There's a buzzword that I'm not going to use, just so you guys want to be aware of it, to describe what this is going to be. And using all of that, you want to think about, okay, what organism is causing this? How does this organism cause this? And is there another organism I could think of that has a similar mechanism of action in terms of activating an intracellular signaling pathway? So multi-step, difficult, but you will see these kind of questions on your steps, because they really want you to know the basic science of everything. All right, let's break down. Let's look at the options here, and let's try to figure out what exactly is going on. So we got a bunch of organisms. Option E is Vibrio cholera. Option D is Mycobacterium tuberculosis. Option choice E is enterohemorrhagic E. coli. Option D is Corynebacterium diphtheriae. And option choice A is Clostridium perfringens. Again, all these are high yield bugs, and you need to know kind of how the mechanism by which they cause problems, right? They're virulence factors, is a buzzword that they use. But which is most similar to the organism causing this skin sore seen in this patient? Take your time, think about it. Let's try to come up with an educated guess if you don't know.
Okay, I'm going to the poll. As I said, this is a very long lead-in, so it actually doesn't fit within the quick poll system. So hopefully you've got your choice already nailed. So I'm going to launch the poll now, and I want you to let us know which is the organism that is correct here. Okay, now the votes are starting to flood in. Hats off to the crowd tonight. You guys have done a nice job and been very responsive. We've seen some good engagement within the question box. Great comments, great questions, great follow-up. Hats off. And then let's see. Almost 3/4 of you have voted. So let's go ahead and get ready to close the poll. And we'll share the results. So let's see. Pretty tight race there for first place between Clostridium perfringens and Corynebacterium diphtheriae. So kind of neck and neck there. Vibrio cholera, 19%. A few people went with Mycobacterium TB and enterohemorrhagic E. coli. Okay, interesting. So let's go ahead and hide the results and reveal the answer. And the answer is answer choice E, Vibrio cholera. So, key one, as is usually the case with Question Lab, we back the harder questions. I definitely want to challenge you. So, since only about 1 out of 5 of you got it right, we're gonna spend a little time breaking it down so you get it right next time. Take it away, Abraham.
All right. Well, nice try, guys. Again, I knew this one was going to stump a lot of you guys, so that's why I threw that in there as the last question. Definitely a difficult one, but I did see a lot of people be able to get the first step correct, right? So based on the description of the findings and the firefighter bioterrorism attack, this points towards anthrax, right? It's a black eschar-like lesion due to a bacillus anthrax, anthracis bug. And that's the very first step, right? Understanding that, hey, this is anthrax. And then that's something that you need to understand first. It causes a painless necrotic skin lesion that then causes kind of, issues with like in terms of infection and things like that. That's the first step. Now, second step is look at this crazy big lead in. Okay, so you got the organism and you have to think about how does bacillus anthrax work? And how does it cause this issue? And you have to think about the mechanism by which the toxin works. Well, the anthrax toxin works by increasing intracellular CAMP. And that is kind of the big key important factor here. If you can understand that the bacillus anthrax has something called edema factor and lethal factor and all these things like that, the idea is at the end of it, it converts ATP to CAMP, which increases your intracellular CAMP, which is what causes all these things to cascade down and cause problems. It causes necrosis of tissue and swelling. It's very important to understand that. Well, let's connect that to the options, right? Let's look at some of the options and let's figure out what toxins each of these have. Each of these contains some type of toxin. we'll look at option choice A. We have Clostridium perfringens. Or perfringens, a lot of you guys picked that one. That does produce what's called an alpha toxin, which essentially kind of breaks down the phospholipid bilayer and destroys cell membranes and tissues. So alpha toxin, which has something called lecithinase, which then breaks down the phospholipids in the cells, and that's how that causes problems and causes like gas gangrene and things like that. Option choice B, a lot of guys also picked that, Clostridium diphtheriae, and that also has a diphtheria toxin. And that one is a very high yield toxin because it inactivates elongation factor 2. Now, they can ask you a very similar question where they give you somebody with diphtheria and say, hey, what other bug has a similar toxin? And you're going to say Pseudomonas. So Pseudomonas and Corynebacterium, they have similar toxins. And in this situation, the Vibrio cholera and Bacillus anthrax has similar toxins. What about the EHEC, enterohemorrhagic E. coli? Well, that has the Shiga-like toxin. So that's very similar to the Shigella, right? These are like, they want you to study it and understand it, but also apply that knowledge where they want you to understand, oh, this organism is working similar to this organism. So it has similar type mechanism how they work. And they want you to kind of think outside the box and not just memorize, oh, this equals this equals this. You want to kind of think and apply that knowledge when you answer these questions. And then TB does not have any exotoxins it produces, but it does have, you know, certain virulence factors that's not secreted. They're endotoxins. So it would not be one that we would think about in this situation. But Vibrio cholera increases CAMP just like my Bacillus anthrax. My Corynebacterium diphtheria causes inactivation of elongation factor 2, just like Pseudomonas. And then my EHEC, enterohemorrhagic E. coli, causes Shiga-like toxin, just like Shigella. So very similar bugs that have different names, and you have to kind of be able to connect the two with the mechanism how they work. Hope that was helpful. Hope you guys, next time you see something like this and they try to ask you about organism that releases a toxin that's similar, you kind of know what they're trying to get at here. Great job.
Okay, thank you, Abraham, and yes, well done, everybody. Rich session. We've covered a lot here in the micro and immuno areas, so I hope that this has been helpful for you. We have all of the question IDs. Right here, and let me see if I can pull up